Well, that was a very kind introduction. I'm not sure I deserved it. Anyways, good evening. I am proud to stand before you this evening and to seek your support. I am the Democratic nominee for re-election to the State Senate for the 31st.
Yay!
I seek re-election because I have this fierce desire to continue to take our fight for Arlington's democratic values to the Commonwealth. It's something that I'm passionate about, it's something that I feel is the right thing to do, and it's something I'm getting good at. So, I think those are great factors. I offer experience and leadership and deep knowledge of this community. As many of you know, I served for 14 years on the county board, and I want to give a shout out to my former colleagues on the county board, my current colleagues on the county board, and the school board members. Local government is very challenging, but you have many opportunities to build consensus and to make a tangible difference in people's lives and in our greater community. So, my hat's off to our local officials. Thank you. In my first term as a senator, I achieved many successes. 15 bills passed in addition to some study bills, and they were either signed by Governor McDonald or by Governor McAuliffe. And we actually did 3 slides, so I just want to highlight, I don't mention every bill that I worked on that passed, but I just want to highlight what my priorities have been and where I've had successes. Thank you. As many of you know, it was pretty heavily covered in the papers. I did get a bill passed that will require the Department of Education to issue regulations on when seclusion and restraint should be used in our public schools. This is very important because we often have children who really have either mental health issues or developmental disabilities, and they're just not being integrated in the proper fashion into our school system. I am still fighting to extend some foster care services, what we would call federal subsidies, to foster youth until they reach the age of 21. This will enable our foster youth to create an education plan or a job training program and to actually go on and get their pathway to life started on a very productive schedule. So it's really important. This is a critical period for our young people. One of my bills was actually rolled into a Republican bill, as many of them were this past session. And, but one of the highlights of this bill, and I think this is a great highlight, is home daycare providers now will be required to tell parents if they are not licensed. So at least parents will know what they're we have to go, much further in terms of setting up a regulatory framework, ensuring that our children are safe and they get high quality care when they are in that early child daycare setting. I was re-elected vice chair of the State Commission on Youth. It is a bipartisan commission with lawmakers appointed by the General Assembly and outside experts. And this is really one of the joys of my General Assembly service. Defending women's health, of course all of us have endorsed Attorney General hearings with the limitation on trap regulations, which was excellent. He said trap regulations will apply to new clinics only. This is incredibly important because the trap regulations applied hospital regulations that dealt with the physical layout of a women's health clinic. And in fact, it was prohibitively expensive to renovate these small clinics, and 2 of them have closed. So because of the Attorney General's new ruling, we should be able to keep the remaining 18 open. And it's defeated, along with a lot of other Democrats, and certainly my colleague, Senator Janet Howell, who played a leading role in this. We defeated the invasive, medically unnecessary transvaginal ultrasounds. This is just to give you a flavor of what happens in the no telling what some lawmakers will come up with, attempted to prohibit convicted sexual offenders from possessing a firearm. What this was about is I put in a bill to require that folks who had been convicted of misdemeanor sexual assault or sexual battery of a household member or stalking crimes, that they just lose the right to possess a firearm for a period of time, and then they could reapply to get the firearm back. The purpose of my bill was based on sound public policy. We were trying to ensure that there was a cooling off period for these perpetrators. Perhaps they could get into some kind of program to help manage their temper and help manage violent outbursts. We learned that a woman in a domestic violence situation is 7 times more likely to be killed if a firearm is involved. Unfortunately, this didn't pass, but there was a lot of drama around it. The bill went before the Courts of Justice Committee, and surprisingly enough, and it was a very tense meeting, there were advocates on both sides, the NRA was there, but we also had all these women's groups and law enforcement supporting the bill, so it was a very tense hearing. And the chair of Courts of Justice announced that the bill was reported out, and all the newspapers were there, and they reported immediately. You know, this bill passes Courts of Justice. So my staff goes to post a newsletter or a news clip on it, and we pull up the actual vote that the clerk posts and learned that it had failed. Well, we learned this at the same time the press learned it, and God bless the press. They were not going to be noted as being wrong. So they camped outside my office and said, what are you going to do about it? And I said, well, I'm going to ask the Republican chair for a reconsideration and for a recorded vote. This is one of the things that really needs to change in Richmond. The chairs of the committees have the opportunity, or discretion is a better word, to decide when votes will be a roll call vote or recorded as a roll call vote. So, so they did my work for me. The press went to the chair of the committee and said, you know, you're doing a reconsideration, you're going to have a roll call vote this time. We reported that you said it passed, and they had it on tape and all that, so I got my way. We had another opportunity to present the bill. We narrowed it. We tried to make it as palatable as possible to any moderate Republican. The bill did pass, but it was referred to finance. It passed that committee. It was referred to finance and then killed in finance. And then the governor, bless his soul, comes back in the veto session and takes one of the pretty egregious bills that the far-right Republican caucus had gotten through the General Assembly and slaps my bill on it. So, so we got to get roll call votes on that bill in the House of Delegates, which was helpful. And I don't have to explain to you why. I think I've connected the dots and you all get it. So what else did I want to say? Oh, campus sexual assault. This was a heavy lift this last session. We had well-intentioned lawmakers on both sides of the aisle, pretty determined to require mandatory reporting on behalf of college administrators. I was very concerned. As many of you know, I'm associated with the university, have been for 19 years. We were all worried that victims of sexual assault would not come forward if it was a mandatory reporting immediately. So I worked with the universities and managed to amend Senator Black's legislation, so we made headway on this issue. We can keep the identity of the victim protected and still have a more robust campus investigation. My amendment also added considerable services for the victims of domestic violence. Protecting consumers and improving health care. Well, many of you know my professional background has been in healthcare policy. 3 bills that I was very proud of. I now require the Virginia Corporation Commission to evaluate situations where insurance companies, for one reason or another, divest some of their resources. Well, it's their reserves. And if they do divest their reserves, what impact will that have on Virginia ratepayers? So this was a really good bill to get through. Working with the AARP, I improved hospital discharge support for patients and their families. This was well needed. Now patients are given the opportunity to name a family member who's responsible for follow-up care, and the hospitals have to work with that family member. And then home health care agencies and hospices have to report disciplinary actions to the state Department of Health now, and that's a really important element because more and more of us are getting home health care. We need to have qualified, compassionate health professionals providing that. Of course, I fought for Medicaid expansion this year. They wouldn't allow debate on the floor, but on a point of personal privilege, myself, Senator Barker, and our caucus chair, Senator McEachin, stood up and covered the whole waterfront on Medicaid expansion. One of the highlights of this year's session was we did get improvements in mental health services. So finally, you have been very gracious with your time. I just wanted to give you a flavor of what happened in the General Assembly, so I'm going to leave you with a slide that might entertain you but drives the point home. You've got a choice. You can work for Democrats. You can help us elect a Democratic Senate, which is absolutely critical. And if you care about a Democratic Senate, we can move forward with Arlington values and not Stone Age values. We can make a difference in kids' lives. I promise you K through 12 education will be better funded. Higher education will be better funded. We will make progress on Medicaid expansion, and LGBT equality will come in all forms. So, thank you very much for your support in past years. Thank you for what you're going to do in the future. And really, thank you for standing with us. I do want to take a moment. My campaign manager is here, Abigail Fox. There she is.